good evening and welcome to African Voices platform on Sheffield Live. My name is Chiwe and I'll be your host today. We'll be speaking to Shahida Siddique from FaithStar, who has been responsible for the BAME strategy, COVID-19 strategy here in Sheffield. My colleague Bailo Jallo joins me as co-host. Hi Bailo.
Hi Chiwe.
Lovely to have you. So we've got Shahida Siddique today.
Hi Shahid.
Morning.
Lovely to have you, Shahida. Could you please tell us a bit about the role? What is it that you've been doing for the BAME community in relation to COVID and the strategy?
Okay, so obviously when the lockdown first hit, it was obviously a huge shock to the nation, and different communities across the country were impacted in different ways. And particularly in Sheffield, with we have 20% BAME population in the city, and in the initial days of the lockdown, from a strategic perspective, not a frontline grassroots perspective, but from a strategic perspective, there was no voice in terms of what the impact was on BAME communities, what support and services were out there for BAME communities, were their voices being heard in the right place. My initial work was very much focused around the faith communities because I was also the faith sector lead. And then very, very quickly, within a matter of days, it became apparent that BAME communities were being disproportionately impacted through infection rates and death rates. And I sort of raised the flag and said, well, hold on a minute, you know, many of our BAME communities, and at that particular point, we didn't know what the shape of the virus was. And it was kind of really a real kind of shock moment when we kind of thought, hold on a second, if this virus takes hold in any one of our communities here in Sheffield, it could have a huge detrimental impact on them, particularly because so many of our BAME communities have significant underlying health conditions, so things like hypertension, diabetes, blood disorders, I can't think right now of the others, but there was quite a few underlying health conditions that for various different communities impacted on them in different ways. So for some communities it was around a higher degree of respiratory diseases. For others, it was around diabetes, and depending on what community you were from, that prevalence was higher as compared to the wider population. So kind of having looked at that from a health perspective, my sort of flag waving in the city was kind of like, oh, hold on, I think we need to have a citywide response in terms of what we're doing to help and support communities. And sort of put a call out to various people and said, look, you know, we need to come together, we need to do something, and we need a strategic approach to it as well, because this is a citywide response, and different communities are going to have different needs. Within a matter of days, you know, BAME groups, activists, organisations, voluntary groups, businesses, communities, their grassroots local response was absolutely phenomenal. I mean, it was unbelievable. And one of the things that the pandemic highlighted was that, you know, communities just stepped up for themselves. That was it. They just stepped up for themselves, and that on a kind of hands-on practical basis, whether it was getting food packages out, whether it was supporting people in isolation, and demand for their services just went through the roof. The flip side of that, though, sadly, was that there was a huge disconnect between institutions in this city and those BAME communities. And that's kind of where my role came in. And I see myself very much as a facilitator and a conduit. And it became very clear that if we didn't have a BAME strategy that connected the decision makers and those leading the response directly with communities, then we were at risk of potentially not supporting where the greatest need was. And so my role very much from a BAME strategy perspective was, at that particular point, was very much around empowering and enabling voice to be heard, and empowering, enabling people to be have their work and support seen, to be recognised for the things that they were doing. That was really important. So that's kind of how I ended up leading on the BAME strategy for the city. It's very much about ensuring that we're opening doors where we need to, ensuring that there's voice and representation where it needs to be, and just reconnecting the leadership and the decision makers of the city directly back with communities. So very much the kind of bridge building in a lot of ways, because previously for the last 15 years we had lost a lot of those bridges and those connections.
Okay, so where are you at this moment with the strategy in terms of the phasing? Where have you come from on the phases, and then where are you at present?
So where we are at present is over the last few months, we've been very much engaged with grassroots conversations, particularly from an organisational community perspective, whether it's across a variety of different issues: housing, education, the voluntary sector, mental health, the response to COVID. One of the things that the pandemic did, and you'll have seen the Kevin Fenton review on the disproportionate impact on BAME communities. One of the things that it highlighted was the massive structural inequalities faced by BAME communities, and those structural inequalities also then added to the sort of impact of COVID on those communities. So part of that, what we've had to do over the last few months is firstly to bring people together around a strategy, to have a shared vision and ownership. So we did a lot of work with communities and community organisations to sort of say, okay, what is it you want to see in this? So we've had an initial conversation around education, and the next phase of that is to bring together BAME professionals and specialists within the education sector to help shape that. This is very much, the strategy is very much owned, co-produced and co-designed by BAME communities. And that's really important, because we felt that a strategy that we were then going to put to the city had to reflect the communities that it was going to potentially impact. And right, very much from the word go, for us it was really important that the strategy was owned by the community. And so part of those conversations, so that first phase was very much about kind of coming alongside communities to see where they were at with things. So for some people, housing was important. For other people, education, enterprise was important. For other people, so depending on what point communities were at, different things were important to them. And so those conversations are ongoing. The next phase of those conversations is to get some clear objectives and clear priorities from communities around those themes. So, if we're talking about, for example, women's health or leadership in the city, what does that actually feel like and look like, and what do you want that to be? And what we've been hearing from communities is they want demonstrable action. They want, a lot of the feedback is that we've had from people is, Shahida, for years we've had recommendation after recommendation after consultation after consultation. The bit that we never see is the action. What happens after that consultation? What happens after that recommendation? So what we've wanted to kind of do as part of the strategy is have a very clear action plan that underpins that is measurable. So communities can see for themselves that, they've said, well, we wanted the following, and what have we done together as a city to achieve the following? So that's part of the recovery phase, and that's kind of where we're shifting into now. But it's a process, because we're dealing with so many different communities and they're all at different points of the journey. And some of our more older established BAME communities, their lived experience is very different from our more newer arrival communities. Their experience yet again is very different, and it's trying to kind of balance the needs of that established and newer communities, and their experiences are very, very different. And it's kind of trying to ensure we take a very nuanced approach to that. So our sort of next phase of where we're going is very much around making sure that we've heard as many voices as possible, included as many people as possible, and really try to ensure that equity in engagement and equity of voice. And then the third and final phase will be really to try to hold institutions in the city to account and say, well, this is what the community is saying it needs and wants. What are you doing to deliver that? And part of that process is there was a set of 7 recommendations, national recommendations, that came out of the Kevin Fenton review. I'm pleased to say that pretty much we've got the Health and Wellbeing Board in Sheffield who have endorsed those 7 recommendations. The Sheffield First Partnership Board has endorsed those 7 recommendations. It's working its way through the Cabinet at Council, and other institutions across the city. So alongside the work we're doing locally, what we're also trying to do is ensure that those 7 recommendations from the Kevin Fenton review are implemented at a strategic level in the city, not just endorsed, because it's very easy for somebody to say, of course, why would we disagree with those recommendations? Of course we back those. But saying that and then implementing actions to make it happen is very different.
How do you intend to ensure that action is taking place? So what's the strategy around that? How do you ensure that there's implementation across the board?
So the ways in which we're doing that is by ensuring that decision makers in the city directly speak to and share in the lived experience of communities in Sheffield. So for certainly I'd say the last 10 years, there's been a failure on part of institutions in the city where they've not directly gone to communities and heard from them. And one of the things that we've been doing, we've co-hosted with Public Health, the Public Health and BAME stakeholder group. And that is a really important group. It brings together 30 BAME organisations in the city, directly speaking to not just public health and other institutions in the city, but we're bringing decision makers to that meeting. And then decision makers are hearing directly from the lived experiences of not just those community organisations, but the communities that they represent. So whether it's, hearing about the struggles of young BAME people in our city around mental health, around suicide, around lack of resources, around support around their education and exclusions, whether that's speaking to decision makers around mental health, health and well-being, the worries about misinformation about COVID-19 and the impact that that's having on communities, connecting them to the right services, so a whole range of things. And already the dynamics in the city have changed because decision makers and leaders are hearing directly from those communities that are impacted. It hasn't come through a report, it hasn't come through an intermediary organisation. What it's come through is a shared space, because that's the platform that we've created, is a shared space where the lived experiences of our communities is being heard in such a way that you can't ignore it, because because by the time that lived experience goes in a report and it gets to the decision makers, it's been diluted to such an extent. It's one sentence in a report, and one sentence in a report isn't going to really give you the impact of what it means to hear from a community organisation that says, I'm having to support a young person around their mental health, or I'm struggling, I've had to struggle with my volunteers, and my volunteers are having to go out and, help get food to people, or help people in poverty, or help people who are struggling, and a whole range of things like that. And it really humbles you. It humbles you to hear the sheer amount of not just work, but the compassion and the care with which our BAME community organisations in this city have stepped up for communities. And it's really humbling when you look at some of these organisations. They have no resources. Some of them haven't had any resources for 10 years. And for them, they've just been barely surviving. And then the pandemic hits, and then demand for their services goes through the roof. They're not resourced to do that work. But despite that, they've carried on supporting their communities, whether it's translating items or connecting people into the correct services, whether it's hand-holding, supporting people on a whole range of different issues. It's such a myriad, it's so diverse, the support that they've done, it's amazing.
How many organizations do you think you've managed, organizations and groups you've managed to bring on board through this process, especially when it comes to interacting with policymakers? How many from around Sheffield would you think?
So from around sort of charitable social enterprises and community organizations in excess of 30. Mm-hmm. And then when you add in the voluntary groups, the smaller community groups, volunteer-led community groups, nearing to about 50. So, and they are all BAME community organizations, and some of them are organizations around mental health, some of them are around women's groups, some of them are around LGBT plus groups, a whole range of different, very diverse groups. I think the one thing I would say about that process is the willingness and the commitment from groups to come together to support their communities, where previously people were so they had no choice. They were working in silos because they were just so focused on surviving that many of them never really had an opportunity to thrive, and so that was really difficult for quite a lot of them. But actually through the pandemic and through this process, a lot of those groups and organizations and charities have realized that their collective voice on behalf of their communities is so much stronger. And it's been amazing. It's a difficult process, absolutely, because trying to establish trust between people and gaining people's trust is a massive thing, and you have to earn that trust. Nobody's going to give it to you. You have to earn that trust, and that kind of trust building, bridge building, has been, I would probably say, the most integral thing to bringing people together. And when we've been able to succeed in that trust building, it's been completely for the communities that they serve.
So when you talk, I'm just going to ask you this question, then I'll get my colleague Viola to come in. So when you talk about thriving, that they're thriving, obviously under unfortunate circumstances, they're thriving. Does that mean they're now being resourced? Is this part of the strategy? Are they be able to get resourced in order to deliver that work or not?
No, when I mean by thriving, what I'm saying is that had they had the resources before the pandemic, so before the pandemic, they were just about surviving. Forget about thriving. They never thrived because they were never resourced. But in terms of going forward, we have so many talented people in this city from BAME communities. We have community organizations that really, really know their communities and what they're about. And with the right resources, with the right investment, they would absolutely thrive. And with them, those communities would thrive. And I think it's been that lack of investment for many years that has meant that those community organizations have just about survived and kept going for their communities. My hope and aspiration would be that we can strengthen their foundation so that they absolutely do thrive. But for that to happen, they need to be resourced properly, and they need to be seen for the work that they're doing, and that's the most important thing to me. So I would like to shift us as BAME organizations from that surviving mode into that thriving mode where they're seen for the work that they do and the support that they give.
Bailo?
Yeah, Shahida, thank you very much for joining us on African Voices today. It seems a lot needed to be done in a very short period, and at a time when everyone was kind of like not expecting it or not prepared for it.
Yeah.
So thumbs up for that. But right now, in terms of what you've just said, looking at or hearing you saying most of the BAME communities were just kind of like surviving, and some of these communities might have been there maybe for at least 5 years or even more, some even more than 10, 15 years. So in terms of that, what will you say is the reason to this?
I think a lot of it has got to do with austerity. So, over the last 10, 15 years, austerity has hit our communities disproportionately. National policy has hit our communities disproportionately. And then I think over the years, communities have changed and evolved. And, you know, that kind of structural investment and legacy building in our community, you can't thrive and you can't build for the future if you're not properly resourced to do that. And I think over the years, particularly over the last 10, 15 years, where you think about historically where many of our community organizations came from, you know, they were first migrant generation communities who physically built their community centres, you know. So you can name any BAME community centre in this city, and I can guarantee you that the BAME communities themselves physically built those organizations, you know, painted them, built them, did the woodwork in them, you know, all of that kind of stuff. But sadly, it's like anything, if you don't maintain it, there will be a decline. And that decline, I think, was partly due to you know, people moving on and not having the capacity within those organizations. Because if you look at it, in some ways, you know, many of those BAME organizations, they didn't have professional bid writers. You know, let's not beat around the bush. If you don't have professional bid writers helping you to bring in the big money, you're going to survive on what you have. And many of those organizations have survived because their communities have supported them. So, you know, they've gone and used their community centres, they've bought their community products, they've supported their community projects and activities in so many different ways. So in some ways, it's been because of BAME communities that those organisations are still here today. And I think it's that we have to remember that we're stood on the shoulders of people who were very pioneering, the first migrant workers to this city. When you look at all the community centres across Sheffield, particularly for BAME communities, they were created by our forefathers and mothers for us. They had a vision about our future, which said, okay, what is there for our communities? And they invested in that and they built that up for us. And I think the responsibility is incumbent on us now to think about the next generation, to think about the future generations. And the way we're going to do that is by reconnecting those community organizations to not just the decision makers and policy makers, but to change the narrative, to say, look, you know, we have the solutions, we know how to support our communities. We don't need to be, you know, we don't need a kind of paternalistic approach. We don't need institutions coming into us and saying, well, we think you should do the following. What we just need is people to listen to us, hear those solutions, hear and be seen. I think that's really important. But, you know, you've raised a really important question. How did we get to that decline? That decline was sadly because as a city, we lost sight of our cultural heritage and our community assets from within BAME communities.
You've highlighted here quite a few points, or lots of points that are really very important and needs tackling, but we're also having a very short period of time. We will not be able to speak about all of them. But looking at the timescale right now and where we are in terms of COVID-19, and looking at the wider public in general, when I say the wider public, I mean like including the wider white community and Sheffield City Council as an institution, and people like you who are facilitating between the wider community and BAME community. How will you describe the relationship right now?
I would describe the relationship as it's a start of a journey. People are reconnecting and re-establishing that trust. I mean, there was a massive trust deficit between BAME communities and institutions in the city. And you're talking at least 15 years, no community engagement, no community outreach, no community conversations. And for a lot of those institutions in the city, there was a recognition that they needed to rebuild trust. But the issue that we had is we're in the middle of a pandemic, so we don't have 2 years and 3 years for people to go out and visit places and visit communities and re-establish and rebuild those relationships. So we had to kind of connect people in the shortest possible time, in the shortest possible space, because lives depended on it. And I think that's where community, for me, what's been the most humbling thing is community organizations sharing their lived experience, but also looking forward. So acknowledging their hurt and their trauma and their disengagement and their disillusionment with the city, but at the same time saying, notwithstanding all of the heartache and pain that we've gone through, our communities need us right now, so we need to look forward and we need to work with institutions in the city to support those communities. So it's been very much about re-establishing trust. So where we are right now, I would say that there is a process of listening. We're at that process of listening where institutions in the city are listening. And for the first time in a very long time, BAME community organizations and BAME communities are sharing their lived experience on their own terms. And what I mean by that is they've not been invited to share that. They're inviting the decision makers and the leaders and the policy makers into their space and saying, come and share in what I'm going through. And that's quite different, because previously for BAME communities, institutions have normally gone to them and saying, oh, we're doing a consultation on X, Y, and Z. Can we come and talk to you about X, Y, and Z? And then those communities might never hear from it again. So they've never really closed that loop. Whereas this time round, BAME community organizations and BAME communities themselves are saying, this is our space and our narrative, and this is our lived experience, but we want to share it with you on our terms. And so there's very much a listening process, and I would say that's the point of the journey we're on, re-establishing relationships, but very much from a point of view of listening.
So in terms of representation, Chiwe, sorry, you will come back in a minute. I'm just looking at in terms of representation now in the council. As you will know, over the past decade or so, in terms of representation with the BAME community, I will not say that has been lacking, but it's been really an uphill battle. It's like, if I'm allowed to put it into my own word, like to say, it's like one person climbs the ladder, then the ladder is taken off, then they say, oh, look, you can get there. That person has got there, but then that ladder that was used for the person to climb up, that ladder is not there anymore. So people like you that are there right now, how are you making sure that the interests of the BAME community in general is represented and is heard, and to make sure as well that, as you mentioned earlier, that we, the BAME community, have been the people that have been really been most affected by COVID-19. And as we speak, that is still the case, that it also gets to the grassroots level, that people who really need it, or people who are really needing the help and awareness to know about COVID-19, that it is getting right to the bottom where it needs to be.
Yeah. So the ways in which I'm so glad you asked that question. It's such an important question. My organisation, we did some research, I think it's about 2-3 years ago now, and we were looking at BAME representation on decision-making bodies in Sheffield City region. And to just give you some statistics, the national average for BAME decision makers nationally is 18%. And in the Sheffield City region, that's under 4%. And specifically in Sheffield, BAME representation on decision-making bodies, and that's across the public, the private, and the third sector, is under 2%. So when you equate that to the fact that there's 20% of the population of Sheffield is BAME, and yet when it comes to leadership that is representative of those communities, we don't even amount to 2%. You know what I mean? It's just, you just think, how does that even work? And in terms of the point that you make about people, they get to a certain position and then the ladder gets removed, we've been very conscious of that throughout, from the moment I set up my organization, it's been rooted in social justice and equity. And we're very proud of the fact that we have an ethos that runs right through the heart of our organization. And it's called, and you've asked me how I personally do that. And we do that every single day in every single action that we take. And that's because we have an ethos in our organization called Step Up and Look Back. And that's purely based on for our BAME communities. Okay, so what we mean by Step Up and Look Back is every time we get a new contact, get into a new space, open a door where there's been no BAME voices before, or we find ourselves in a position to advocate on behalf of communities. As soon as we acquire that, the first thing we do is we look back and we think, okay, who else, or which other organization, or which other individual, or which other community could benefit from this? And then we actively and consciously go out and make that connection. So for example, we've had young BAME activists who, might be doing their PhD research, or there may be people who are just coming into the voluntary sector. And, what we'll do is we'll connect people and say, you're doing a really interesting piece of work there. By the way, are you speaking to the following people? And we don't just kind of send an email and say, speak to X, Y, and Z. We actively introduce people, and wherever we can, we uplift and champion the talents of people within the BAME community. And we will champion those individuals and say, by the way, there's this amazing person in the BAME community who's doing the following stuff around, you pick a subject, any subject, we will champion that person. And we champion that person in whatever forum or arena we can get into. And so a lot of what we do is very much about acting as a conduit. Where we sometimes go into high-level meetings and people will say to us, oh, Shahida, will you be the BME representative? And I'll be like, no. And they're very shocked when they hear that, and they're like, what do you mean? And I'm like, well, if you want BME representation on your board, go out and recruit those members properly. Go out and interview and engage with and get the right people around the table. I'm here for a specific purpose, and that's what I'm here for. So if, say, for example, if it's about poverty, or if it's around faith and sexuality, if it's around education, you name it, whatever. But that kind of tokenistic approach that people want to take, because they think, oh, perfect, there it is, she's a woman, she's Muslim, she's a woman of color, she wears a scarf, I wonder if she's disabled. And you can just see the tick boxes going through their head, and you're just thinking, I wonder if we could even question her sexuality, because then we'd have literally every diversity tick box ticked, and she's like this all-in-one person. And we push back against that, actively push back against that, and say, nope, unless we are being directly endorsed by the BAME communities to do something on their behalf, I am not your token, and neither is my organization. If, however, you want that BAME representation, I am more than happy to facilitate you and connect you to the people you need to be. And that's been the interesting thing, because it's challenged and provoked people, because it's not an easy
Sorry to interrupt you there, Shahida. So right now, will you say, in terms of that representation for the BAME community, you've been given that blessing now?
Yeah, I think one of the most humbling experiences for me was when the pandemic first hit. I'll be honest here, I was really scared of taking that leadership role, because I thought, who's endorsed me? Who's telling me that I can advocate on their behalf? It was a really scary position to be in that, for me, it was very much about, this is about saving lives. And, I couldn't live with myself if I thought, actually, I could have done something to support my communities, all my BAME communities. I could have done something, and I didn't. But I was very mindful of the fact that I couldn't do that without blessing and support and endorsement. And it was such a humbling experience when people from pretty much, you know, every BAME community in the city was like, we trust you, and we know you, and we know you will act with integrity, and we know that you will speak for all of us, and you have our blessing to do what you need to do for us and maintain. I mean, as an example, we reached out to the Sheffield Roma community and, you know, said to them, look, you know, we want to support you. How can we support you? We want to make sure that you have a voice in the right spaces like other BAME communities. How can we support you to do that? And to get their blessing, you know, for somebody to turn around and say to you, thank you, you're the first person who has come and had a conversation with us and wanted to share that space with us. And, you know, and I have to say this, and it's really important, it is not about me, okay? In any shape, way, or form, this is not about me. And that's something I struggle with on a daily basis, because leadership is about taking people with you, and that hasn't been easy because nobody has a reason to trust me. Some people know me really well, and some people have only just got to know me through the pandemic. And so earning that trust has been the most important thing for me. And I think the thing that I treasure the most throughout this pandemic has been the blessing and endorsement of communities who've entrusted me to support them, really. And that has been really, really humbling. And I hope that in some small measure, the things that I do can help to improve things for people.
Where do you actually then, in that case, see your role and the role of FaithStar beyond the pandemic, as far as what's been done now with the BAME community? Where do you think you're going to be taking what direction are you going to be taking with this current role?
So my hope is that my role beyond this pandemic is very much, you know, once those relationships have been reestablished and really strengthened between institutions and communities in the city, that I'll be able to step away. I don't see this as a permanent role. Very, very much, as I have always seen my role and leadership in this is very much just facilitation, and very much about, like I say, reconnecting and reimagining a different type of Sheffield, but one that serves all of its citizens. And so for me, my role sort of going in the future is, once I've kind of done that task of reconnecting people and there's strong relationships there, and I know that BAME communities have an equity of voice in the city, then I'll be able to kind of step away. And my hope is to, you know, get back to sort of the things that I'm passionate about, which is working at a grassroots level with communities. You know, so very much it's kind of, I'm here while other people want me to be here, and I'll be here to support, to strengthen those relationships. But once that piece of work is done, it's very much about stepping away. And I'm very passionate about legacy building. And for me, legacy building is ensuring that we have the next generation. We have nurtured and supported the next generation of BAME leaders in this city. And so for me, it's very much about being that stepping stone for the next generation.
Right.
You will understand, Shahida, as well. The BAME community is a very broad term. There are kind of like so many people or so many communities involved. And looking at the situation right now where we are, as you even mentioned earlier, the disconnection has been there for ages, where there are certain organizations that will be, you know, happy with the way things are going, and some will be a bit skeptical because of the past history. So what will you say to those other organizations or other BAME communities that are skeptical? If I say skeptical, I don't mean like not trust you or not having any trust, but other organizations that have concerns about the way things are going on, to reassure them that, look, I'm here to represent you, and I will make sure that the representation is on your interest, not on the interest of other people.
Yeah, so right from the word go, if you look at our social impact report, for example, We've advocated on behalf of women's groups, mental health groups, all sorts of BAME groups in the city, and our actions speak for themselves. So when communities have said to us, you know, get decision makers in front of us, we've done that. When communities have said to us, I'm having XYZ problem with the local authority, I'm not being heard, I'm not being listened to, or I'm being impacted in this way, or my community is struggling in that way, what we've done is ensured that we demonstrate action. And what we're saying to people is, hold us to account. We're not perfect. We're going to get things wrong. So if you think we should be doing something more, or you think we could be doing something better, be critical of us and hold us to account, because actually the biggest critics that we have is ourselves. So we hold ourselves to a very, very high standard. And what I would say to those people who are skeptical, you have every right to be skeptical, because for so long you haven't had anything in this city that's given you hope. You haven't had anything in this city that has said to you, you know, here is a space for you to have your voice. And, you know, I can tell you now that in the institutions in the city, one of the things that we've had to do is we haven't made it easy for people. You know, we've made it very clear we're not anybody's token. We've made it very clear that, you know, we have a long way to go in re-establishing that trust. They've got a lot of work ahead of them. And, you know, until at an individual level, on a community level, on a community organization level, until people feel that impact personally, where they go, actually, this process has made a difference to me, it's going to be really, you know, I don't want to sit here and try to convince people, because actually that would be unfair to them, because they haven't had that experience. They haven't had the experience where, you know, but at the same time, for those people we have made a difference to, they become our biggest champions. They're just like, you know, as an example, we did some work with a group recently. They'd been struggling to get funding for a long time, and we said, no, let's help you. And we did some work with them. They managed to get resourced, and the way in which we did that is we didn't do the funding application for them. We taught them what funders were looking for. We capacity built them, and their feedback to us was, this is the first time we've actually understood how to put a funding application in, what funders are looking for, and going forward, we know now how to get our own funding, because we now know what to do. And I think that's the difference, is empowering people to say, you can do this for yourself. You know your solutions, you know your communities. Here's a bit of infrastructure support, here's a bit of capacity building support. And we're sharing our skills and we're sharing our knowledge. And then when those communities come back to you, and, you know, people send you an email and go, oh, guess what, Shahida, I've just got £10,000 from a funder. Oh my God, this is going to have I can buy those computers now. I can buy those laptops now for those families that we're supporting. It's, again, so humbling. And what I would say to those organizations that are skeptical out there, come to us and say to us, we need you to do the following, or we need support on the following. And we are the kind of people that if we can't help you, we'll connect you to the people that can. And, okay, you know, on that point, just really quickly, I was just going to say that I totally understand their skepticism, totally understand it, because they've not had any other reason not to be.
Well, as much as funding is important as well, because whatever a person is doing, yes, money has to be involved. But in terms of that as well, how are you going to make sure, or as an organization, that this funding that people are getting as well, it does reach to the right people? Because right now, in terms of awareness, there are so many people in the BAME community that doesn't know what's happening, or that doesn't know how to tackle things. So how are you going to make sure as well, as much as this organization, they need funding, and you will help them to get the funding, how are you going to make sure as well it reaches to the right people? Example, the area of Bongrave, high deprivation, looking at Darnell, high deprivation, looking at other areas, so much to mention. How are you going to make sure that this reaches to the right people in terms of young people or the elderly?
The way that we're going to do that, and have been doing that, is making sure that those communities and the people who represent those communities are speaking directly to the decision makers. They're not going through intermediaries, they're speaking directly to them. And their lived experience in terms of making sure that resources get to the right people, that's the thing we've been advocating. We've been advocating really strongly that if you want to support BAME young people, if you want to support BAME elderly people, or women of colour, or BAME families, in all of some of the most deprived areas in Sheffield, you need to go and speak directly to the people supporting them and those communities. And that's the difference, because previously, the only time institutions in this city were interested in talking to those communities is when they needed to consult, as opposed to going to those communities and saying, tell us what you need and let us see how we can resource you. And, there is no magic money tree. There is no, there's not going to be loads of funding dropping on people's heads. However, by connecting communities in Burngreave and in Darnall and making sure that decision makers and policy makers and those who hold the budgets in the city can see what's happening in those communities and hear from the community organisations that are actually supporting them and saying, okay, we know so for example, I'm just thinking about one particular project, does phenomenal work with young people in Burngreave. And, when I look at this project, I think to myself, wow, with the right resources and the right support, already, because decision makers have heard from them, they're looking at Burngreave in a completely different way now, because they're going, okay, there are people on the ground, there are people in grassroots who are already doing this work. And that's where we're advocating. We're saying to people, you don't need to reinvent the wheel. There is somebody already doing that work. Or we're advocating and saying to people, okay, why are you giving money to that big organization over there that with the utmost respect has no BAME representation in it, has no BAME workers in it, but is working in a BAME area? So wouldn't it be more appropriate to give that resource to BAME organizations who are doing the work? Because ultimately some of these larger organizations still have to come to BAME community organizations for them to deliver the work. So it's like, well, why don't you just fund those people directly? And so a lot of the advocating that we're doing is around making sure that those people in the city who have got budgets, we're saying to them, okay, where's the money going and who is it going to? And how can you demonstrate that it's actually supporting the people that need it? So all the questions that you've just asked me are all the same questions that I'm asking strategically across the city and going, but show me how you're supporting communities. In what ways are you supporting communities? How do you know that your money is getting? So as an example, recently we had the accounting chief officer from the clinical care commissioning come and meet with BAME groups. And he was talking about the resources that they put into mental health services. And many of the BAME community groups said directly to this person, said, well, hold on a minute, our communities don't access those services. We only kind of reach, it's only when individuals in our communities reach crisis point, and even then we struggle to engage with the services that you're currently saying that you funded. And immediately that person was like, okay, we need to look at how we're resourcing these services, and we need to be ensuring that BAME communities are heard in terms of mental health services, and are those services appropriate? So already those questions, and because they're hearing from the direct lived experience of BAME communities around mental health, it's making them re-look at the ways in which they're supporting communities, because up until that point they probably thought that they were helping BAME communities. But it's, again, it comes down to advocating where they're not just injustices or inequality, but highlighting the gaps. Because when you look at our community organisations and communities, they don't want to work against institutions. They live in this city, they're citizens. Mm-hmm. How do we re-establish that?
Oh, lovely. Shahida, we're getting quite close to closing off, but wondering now if you could just let people who haven't been part of the strategy and are listening and watching you right now, could you tell them how they can actually be part of it and how they can contribute to the remaining bits and what they should expect beyond once the strategy is complete?
So so they can get in touch with me at shahida.siddique@faithstar.org. They can go to our website, www.faithstarllp.com, and they can also go to the www.ctac.org, or no, ctacuk.org, or some. I'll have to. Sorry, I'm so sorry. I've got the website mixed up, but I'm sure you can put a link or something in there. But certainly, if the email is at info@faithstar.org, and just say, I'm really interested in being involved in the strategy. How do I get involved? We will immediately plug them into where they need to be plugged into.
Just to recap, what should people expect once the strategy document is done?
So what to expect is that this will be a strategy owned by them. So our hope is that as community organisations, that this will help to inform conversations that they're having around the city. So depending on what area that they're working in, they will have a document and a set of recommendations that they can take to the city and say, look, this is what we're a part of. This is the strategy that we've helped develop. These are the recommendations and outcomes that we wish to see. How are you as institutions going to help us to achieve that? So our hope is that by the end of this journey, that communities and community organisations will have taken ownership of that strategy, and they will be very much part and parcel of delivering it, but that they then have something that they can take to institutions in the city and say, this is what we're a part of, and this is how we're going to hold you accountable, and show us how you're helping us to deliver the strategy and the aims from the strategy and the action plans that sit beneath it. And our hope is as well that with the 7 recommendations from the Kevin Fenton review, that'll be an additional set of recommendations that, because they've already been endorsed by the city, BAME community organisations and communities can take those 7 recommendations and say, well, show us how you implemented these recommendations, and that will hopefully empower communities to hold people to account in the city, and to say to the city, demonstrate to us how you're improving.
Brilliant. Thanks so much for joining Bailo and myself. Bailo, did you have a last question before Shahida leaves?
No. All I can say now is to say it's done really well, and we are hoping that the way things have started, hopefully it will continue like that. We know there are challenges out there, but we just hope and pray that those challenges will be tackled in an amicable way to make sure that each and everyone that is there to represent the BAME community, they are representing us, and also not only for us, but let's also not forget about those who are not able to speak for themselves, those who are not able to know what's happening in those institutions or around town, to make sure those marginalized people as well are represented, not only those people who can just have got the louder voice, those with the smaller voice as well are heard, and in terms of awareness as well. Yes, we need the funding, but also when the funding comes, it reaches to the right people, and the awareness is raised, because COVID-19 is still out there. And I do speak to people, and it seems like most of the people in our community still don't know a lot about COVID-19.
Yeah, thank you for that. I mean, it's as I said before, we have so much left to do for our communities, and as I said right at the start of this interview, part of it is so uplifting, as you've seen the way that BAME communities have stepped up in response for their communities, and in other ways it's heartbreaking, because you just see, because of that lack of investment and resource, that how difficult, under the really, really difficult circumstances, that they've had to do that. And I think, we're at the start, very much at the start of reimagining a different kind of Sheffield for everybody. And you're absolutely right, Bailo. It has to be a journey that we all take together, and that's a responsibility But I personally have really taken to heart that we include and empower and enhance as many voices, not just the loudest, but the quietest as well. And I hope that communities in Sheffield, with the relationships that they already have with me, and any new relationships that people want to form with me, that they will hopefully see that they, at the very least, have an advocate in the city that will try her hardest to ensure that as many voices in our city as possible get heard.
Thank you so much, Shahida. It's really been lovely listening to you speaking about the BAME strategy for COVID-19 for Sheffield City, and we're looking forward to implementation and actions beyond that. You've joined Bailo Jallo, my colleague, Shahida Siddique from FaithStar, and myself, Chiwe Chihana, for African Voices Platform, broadcasting from Sheffield. Thanks and good night.